Welcome to my podcast. So today I'm going to talk about another station. So after you introduce yourself and ask the patient name and date of birth, you will ask can I do for you today. The patient will tell you, doctor, I'm having heart racing and I feel all the time my heart is bounding. So we'll ask if there is anything that could trigger this, or if there is any previous medical condition that could have been diagnosed with early on. And you will ask the patient to tell you more about it. So the patient will say, I'm having bounding for no obvious reason. So you will try to think about the main common causes. Say, for instance, you're going to ask if the patient noticed any recent change in the weight, or any recent change in the sleep pattern, or if there is any hyperactivity, of the thyroid. So you will ask about the whole question around the hyperactive thyroid. You will ask if there is any history, for instance, a trouble or sudden pain, or a history of, any history of cough, for instance, history of. So you just try to explore around the whole areas, pneumonia, chronic obstructive airway disease, any history of pulmonary embolism, and any history of high blood pressure. Or any heart disease, non-congenital heart disease. So you need to ask about the whole, questions around this area. And then you will try to see if there is any triggers or risk factor, like, for instance, if the patient is a smoker, if the patient drinking excessively alcohol or caffeine, or tea, coffee, or energy drinks, because all of that are associated, or if the patient is taking any illegal drugs like amphetamine, cocaine. All of that is well known, for causing extrasystole or arrhythmia. So all of that you need just to ask them the questions to just get into the idea what's causing this, racing of the heart. You will ask if there is any feeling of faint or lightheaded, or if the patient collapsed, or if there is any associated of chest pain with that. So you will just need to inquire about the whole question. And then, of course, you will safety net the patient if there is any, something doesn't seem right, if it's sinister, if there is any pain developed recently, goes to the jaw, to the back, or to the neck, or left shoulder, or if the pain is continuous. So you need to tell them to call 999 or go to the A&E immediately. After exploring all of that, so you'll arrange for the examination of the patient. After checking the observation, you will arrange for ECG, just to make sure that the heart rate and the rhythm, everything, in the ECG tracing. And then you will try to figure out what's going on, what's beyond all of that, and you will arrange for certain other investigation. Maybe you need to do chest X-ray, some blood test. If there is any history of anemia, it's one of the factor. You will arrange for thyroid function test as well, and of course. You might consider as well ultrasound, which is echo for the heart, just to make sure that there is nothing missed in the history and the diagnosis of this condition. Of course, you need to bear in mind the age and overall health of the patient, and if he's taking any medication at all for whatever reason. So you will explain that obviously the heart is pumping more than it should be, and in that condition it might leak the needed blood, and this could cause the pain, might cause the feeling that you had. And you will ask if there is any of the beats that doesn't seem like it's coinciding with the others, so it could be extrasystole. And you will just tell him that we need to put you on certain medication to restore the normal heart rhythm, and certain medication to stop being the heart beating at high rate. in order for the heart to beat at normal rhythm. So you just need to explain in short and in simple words so the patient can understand. You wouldn't say, oh, I'm going to give you beta blocker just like that, and then you need to say the simple stuff, and then you mention the name if there is a need later on. And of course, you need to warn about the side effect of the medication you're going to prescribe for the patient after agreed with the patient, and of course, explain that there is certain risk. For instance, with excessive heartbeat and racing, there might be something called blood clot, whereby the heart is not under control. So that's why we need to give you certain medication in order to avoid the consequences. So that's in short. You just need to explain to the patient what's needed. In certain situation, if it's chronic and of course needs further treatment, you will refer to the specialist who might decide for cardioversion or catheter ablation, which is another things, or pacemaker if there's any issue with the heartbeat in the future. So you just need to explain in simple words. So I hope by that I just covered this station and simple stuff that you need just to go around it. Thank you.